Well, hello everyone, and welcome to today's Spotlight session featuring rewarding career opportunities at the County of Santa Clara's Custody Health Services Department. Thanks for taking the time to join us this afternoon. My name is Cassie, and I'm one of the county's recruiters. I'm honored to be your host for this special segment. For the next 45 minutes or so, my job is to bring you valuable insights into the unique world of custody health services, which is a vital part of our county health system that provides medical and behavioral health care inside our county correctional facilities. So you'll hear from our speakers today about their career journeys, the specialized work environment in custody health, and a variety of opportunities that are available in this unique work setting. So we'll wrap up with plenty of time to do questions and answers with our speakers. So please save any questions until the end. Our team will also be available after this session to answer any final questions you have. And one final note, through the whole time we'll be talking today, you'll see the slide up above us with our contact information on the screens here. You can scan that QR code to go to our Custody Health Services Department website to find more information about all of the positions we'll be talking about today. You can also go to our main county career site at sccjobs.org to find out more about county careers. And finally, you can contact us by emailing the address listed there, dei-sourcing@esa.sccgov.org. So please feel free to take a photo of that screen, view that QR code, and save it so that you have our contact information for any future questions that come up. So with that said, I'll get to our incredible panel of speakers. I'm thrilled to have them here with us today. First, we have Antionette Bonner, who's a Program Manager 3, and Alyssa Vanegas, who's a Management Analyst in the department. So I wanted to give them each a minute or so to introduce themselves and talk about their own career paths. So Antionette, can you get us started? Please introduce yourself and share your role as a program manager and what brought you into custody health services.
Hi, so my name is Antionette Bonner. I'm a Program Manager 3. I'm over the mental health department at Elmwood. What brought me in? So I started in custody health around 2015 as an Associate Clinician, and over probably a 2.5-year span, I collected all my hours, and then I became a licensed clinical supervisor. During the time, the first 2 years of that, I actually left Custody Health Services. We always come back, so just know that. But I left Custody Health Services to work with Mobile Crisis Team. It was just starting up in 2018. So I worked there for 2 years, and I was a lead, so I was over the team at the time. And then after that, COVID kind of hit, so we had to work from home, and I'm not a work from home type of a gal, so I reapplied to come back into custody to work. So I came back into custody. When I first started custody, I was a crisis clinician, so that means that we go out and we see the clients that are in crisis at the time, and we go do de-escalations and things like that. When I came back into custody, I worked in the special management unit, and that's a unit that serves the severely mentally ill, and we usually keep a caseload there, and we have, I think I had like 40 clients that I saw throughout the month just to make sure that they were okay, they were stable, encouraging them. From there, I went back to crisis because I like the crisis pace of things, so I went back to crisis. While I was working crisis, I actually did 2 days in our acute psych unit. So I was working with clients that were placed on 5150 holds, and I would do that 2 days a week, and then the other days I did crisis. While doing that, I went to school and I became a trauma therapist. So then I had special clients that I worked with, and I worked with them on the trauma that they were having. And then from there was a position that opened up where it was a work out of class program manager 2. Because my manager was retiring. So then I applied for that, I got it. And then I worked out of class for a little over 6 months. And then at that time, I applied for the actual position and I became a program manager 2. So my program manager 2 job was a little different from some of our other program manager 2s at the time, where I actually was the person that if there was something new coming into custody, I would be like like a project manager, right? So if we had recreation therapists, we never had them in custody, they came in. So then I would do the workflow for that and how is it gonna be? I hired all of them and I trained them. We had mental peer support workers coming in, so I did that too. And then they actually reported to me until I became a program manager 3. So I became a program manager 3. I was a program manager 2 probably for, I think, almost 4 years. And then I became a program manager 3 for the QI department. QI though, you gotta sit at a desk and a computer, and I'm a talkative type of gal, so that didn't quite work out for me. So my old program manager 3, she moved on to another position, so then I moved back into the jail and I became the program manager 3 over crisis. And so that's where I am now. I'm a program manager 3 over crisis, although I'm probably still different from the other program managers because I have 12 staff and one has 1 and the other one has 2. So I am over the rehabilitation counselors, which is a new team that came in that I started and hired for them too and started that project. And then we had medical unit clerks that did discharge planning, so I was over that team too, but I don't know if you guys know, there's a Cal Ames came into the county and they kind of took that over, so they no longer report to me. But that is my story. So I started off as an associate. From an associate, I became licensed. I left the county for a little bit, came back as an associate, then became work out of class program manager 2, then officially a program manager 2, and then 3, what I'm doing now.
Wow, well, thank you so much for sharing your unique path through the county. And it sounds like in the scope of your work, you've worked with a lot of different job titles in this department, so you understand the different roles that we have in this department. We'll talk a little bit more about that. But yeah, next, I wanted to introduce Alyssa. Can you tell me a little bit about what brought you to Custody Health Services and the county?
Hi, my name is Alyssa Vanegas. I have been with the county for a little bit over 10 years. The majority of my experience was with ESA, so the Employee Services Agency, so the department that is hosting this event here. So in that department, I really established my HR knowledge and background. I was looking for more of, I have a passion to provide services to the underprivileged and underserviced population. So I was working with Custody Health Service as their HR department recruitment analyst. So there was an opportunity to become the HR liaison over there, and I took the opportunity because I really wanted to expand my knowledge in HR outside of just recruitment and classification. So in my role now, it's something different every day. I've learned so much. In Custody Health Services, you see everything. It's the hospital system within the jail facilities, so you get every type of position, every type of job function, so there's so much exposure to just any kind of job-related tasks. So it's so much more than recruitment. I get to work with leaves and FMLA and policy procedure development, so it's been very rewarding because the pace is fast, the days go by quick, and I'm learning a lot, and it's very fulfilling knowing that the work that we're doing is being able to provide services to the most probably underserviced population.
Wonderful. Thank you, Alyssa. We miss having you in HR, but we are grateful that you're working with such an important department here at the county. So next, I wanted to go into our main questions and shoot out a couple of our questions to our speakers before we get to your questions. So first I wanted to ask Alyssa, can you tell me a little bit about the department? Where does custody health work? And a little bit about what your patient population looks like?
Yeah, so we have multiple locations. Our main facilities are here at Main Jail over on Heading Street. And then we also have Elmwood, which is in Milpitas. We do have an administration building that's across the street. And then we also have our juvenile services, which is on Guadalupe. So there's multiple locations, and each department has various populations. So for Main Jail, you will get booking. So you're gonna see every type of patient there. A lot of times when people come in for their assessment, it's probably the first time that they've ever been medically or mentally health assessed in their life. So you're gonna have exposure to everything there. And they also stay in that facility while they're going through their trial. When you go to Elmwood, it's more long-term care, so you have more routine. It's more of like a campus. It's lower level security because, you know, people get their sentencing and they see an end site, right? So, but each location offers services that I'm very proud to say that we offer our patients. And so, yeah, you'll see everything.
Great, thank you for giving us that layout. And next, for Antionette, what's it like working inside a correctional facility? And what's a typical day look like for your various healthcare providers and support staff?
So it just depends on which facility. So if you were a clinician working at Main Jail, they cover booking, so people that are being arrested, some of them have to be assessed, not all. And then they cover the floors, so if someone says that they're suicidal or homicidal, they're running up to the floors to assess them and make sure that they're okay. And then we have just routine referrals. So for Main Jail, it would be a little bit of all of that. So you would probably see a couple of people in booking and do that assessment, depending on the time of day. If it's nighttime, majority of your time will be spent in booking, because that's when a lot of people are arrested towards around 9 p.m. on. But during the day, it would be you would be seeing some in booking, some on the floors, and then some of our staff have like special assignments, so they would see those too. Usually they see their special assignments on Wednesday because we're all there. And then if you are in a special management unit at Main Jail, you have a caseload. So you have, say for instance, from 8 to 10, there is a clinician seeing all her clients, and the next person would be from like 10 to 11 or 10 to 12. And so they can kind of schedule out their day if you're working in the special management unit. At Main Jail, at Elmwood, it's special management unit runs the same. This is something we just started, but they have like a couple of hour segments where they see all the clients that they need to see within that time, and that's for special management unit. But our crisis staff is the same, except we don't have booking, but we do have crisis, and we're always running out to a unit if there's a fight. If somebody says they're suicidal or homicidal, or we just need to go and assess someone because they're not doing quite well, and we want to make sure like mentally they're stable. So that was how their day looks. If you were a program manager, we try to plan our days, but we could get an email and that our plan goes out the window, right? But generally, we, as a manager, if you were to take a job at Custody Health, you would be my day, when I do plan it, I would come and I'm over grievances. So anytime a client there puts in a grievance of something, so the inmates in jail can put in grievances. So, but they go through stages. So my program manager too, which is under me, she's the first stage. I'm the second. I look and see what she has written to make sure that it is correct, and then it goes to my boss if that person appeals, and then I might do 2 hours of that, which is because you have to go into HealthLink and you have to research it. And then after that, I might have an incident report. So any incidents that are happening in custody, our nurses, our clinicians, and any workers, managers, we put in incident reports, and so those have to be investigated. So I'm the one in charge of investigating those for the mental health part. There are psychiatrists that do it for that part, and then there are nurses that do it, nurses and doctors. So that's.
And that really speaks to a lot of our mental health. I think on the medical side, our RNs do assessments, they do sick cards. So if somebody is complaining of an illness or they're feeling, something, they will make that request and a nurse will come and see them. Our LVNs do a lot of medication passes. We are doing medical assistants that do blood draws. And we also offer optometry, dental, if you have a prosthetic. We really are an interdisciplinary team, so we work with our mental health, we work with providers like dentists and optometrists, so you really get the full scope of patient care when you come in, and I think that that's something that really speaks to Santa Clara County and providing the best care to these patients. So there's a full range of medical approach to our patients.
Wonderful, thank you. And that was getting at my next question. I was going to ask specifically, what are the different career opportunities? What kinds of positions does your department hire for? You guys have both thrown out a number of different job titles, but tell me a little bit about the scope of the work that you provide.
Yeah, custody health service is very unique in that you're going to get every different type of position. You'll get direct patient care on both medical and mental health side. So on the medical side, some of our most common ones are clinical nurses, LVNs, licensed vocational nurses, medical assistants, which we have a big push right now for hiring medical assistants. And we have a continuous extra help opportunity, just throwing that out there. And but then we also have clerical that supports the direct patient care, so hospital service assistants. Pretty soon we would like to get some health service representatives that will help the billing. And then we have our mental health side, so psychiatric social workers, marriage family therapists, psychiatric technicians. In our more clerical side, we have office specialists that do our scheduling. We have, management analysts, program managers, which monitor policies, procedures, and all of those things. We have middle management, executive management. So our biggest focus is direct patient care. However, our department is unique in that we have all types of positions, even like community workers, rehab counselors, you name it, we probably have a position in our department.
Wonderful. Thanks for sharing those job titles. And one thing I will note when you're talking to anyone from the county about career opportunities, pay attention to those job titles that you're hearing, write them down. Even if we don't have a career opportunity open right now, we're constantly opening new positions. So it's really important that you get on our email list, and so you get a list of all of the openings as new positions open up. Some of our positions are only open for 2 weeks. So get those emails, watch for that job title to come through because you don't know when it's going to open up. So yeah, thank you for sharing that. For Antionette, can you share a little bit about what makes someone successful working in this unique work environment?
I think you just have to have a love for the job that you do in this environment, because it can be I'm not going to sugarcoat it, it can be a hard job at times, but it's rewarding too. Especially, I remember when I was a clinician, and working crisis is kind of hard because it's really fast paced. When you work in case management or you have certain clients that you see, you can kind of see the change, them evolving over time, right? But that to me is when you see them evolve and you know that you were part of that, that is that's something. But I think you just have to have this compassion to work for this group this population. And also, you have to kind of be able, sometimes it is a fast pace, so you have to be able to like maneuver through that. But of course we train you. We're not just gonna throw you out there, but it can be like kind of hectic sometimes and stressful, and but I would just say compassion and just like this love of working for this group.
I think this is that's great to point that out. This is an incredibly vulnerable population, and like Alyssa mentioned, in some cases these people have never seen a healthcare provider in their entire lives. This is the first time they've gotten healthcare in their life. This is the first time they've had someone talk to them with respect. I remember, I think Antionette said once, I was asking her what she likes about her job, and she mentioned patients making her laugh and how important each of these interactions is to these patients who don't get to see a lot of people. These are really life-changing interactions that you have with people. So I really, that's one thing I love about this department. Next, why do you think this is an interesting, and this, this is exactly what we were getting to right there, but why do you think this is an interesting and rewarding place to work? What do you love about it, Alyssa?
I think something that we've spoken to is that, we are providing this patient care to our patients. Like we said, a lot of times this is the first time they're even getting the care that they deserve. One thing that I really respect about this department is that, we see our patients as patients. They deserve respect, they deserve dignity, and they deserve a whole person care. So we really strive to provide the best quality care that we can. We're very fortunate to be in Santa Clara County, where we do offer a lot of services. So it's a very fulfilling and rewarding place to work for. Like we said, it can get hard. It's fast paced, things change. Your days are gonna go by so fast. My days go by so fast. But I have learned so much, and I'm able to translate that into my everyday life, and I feel like it's just made me a better person.
Wonderful.
I was gonna say too, like for clinical wise, when I came, I was an associate, and I have to say, like within 2 years, I learned so much, like the DSM, and I always say in the jail, the DSM comes alive because you literally through booking,
that's
you're
a
like,
diagnostic and statistical manual.
Yes, but you get to see it with the clients that are coming in, but not only do you get to see them at their worst, sometimes you get to see them at their best when they're medicated and they're stable.
Wonderful. Yeah, that's something I hear from folks in this department all the time. This is a really incredible learning opportunity, a learning environment where you're really well supported. You get to see everything, get to interact with everyone in a very well supported and structured environment. Let's see, next I wanted to ask about interviews. If you're applying for a position, and hopefully you get an interview, Alyssa, what advice would you give to candidates interviewing for any position in your department?
Yeah, so I think what's most important for any type of interview is to bring examples. Based on your resume, you qualified, we know you have the experience, but we want to know how you work. So bring in examples of a time that maybe you had to assess something quickly, or provide support to somebody in crisis, or work with other departments to solve a problem. Something that's going to speak to how you think and how you work and how you can get the job done. I would also say our commitment to the patient care. As I said, it's really important for us to remember that our patients are still patients, and that they deserve respect, dignity, and the whole person cares. So if you're able to emphasize your dedication to the patient care, then I think that is super important. And adaptability, so things change, and just being able to think on your feet and move within the process is very important.
Wonderful. Yeah, I'll highlight the mission-driven nature of this work in this department, as well as almost every other department at the County of Santa Clara. Our departments want to hear that you appreciate the work that they do to support vulnerable people in our community. If that's something that's important to you, share that with the interview panel. That's something that's important to them, and they want to hear that. So, Antionette, do you have anything you'd like to add about any tips for anyone going through the application process or the interview process?
Be yourself. Yeah.
I would like to add be patient, because sometimes the recruitment process could be lengthy. I do want to speak to what she was saying, and just with the adaptability, showing that you're able to shift gears and that you're still compassionate in what you do is ultimately the goal here.
Wonderful. Great. And then finally, before we wrap up, I wanted to give one last question for each of you. What's something you wish you knew before you started in your role, or one piece of advice you wish you had when you first started working in custody health? Whoever wants to go first.
I would like to say that don't be scared of the safety issue. You know, a lot of our work, we do work directly with the custody bureau, so your safety, the patient's safety is always our number one priority. That is something that never gets overlooked. That is something that never gets pushed to the side. That is a main focus for us. So there's always going to be like a negative connotation on custody health services because you're within a jail facility. But what I think most people don't understand is that for, you know, nurses and behavioral clinicians, sometimes it's even safer than working in the public, because you do have that custody support with you. Rather, if you're on the outside and you're dealing with a patient that's going through something traumatic or has an episode, you don't have that protection. So I think that getting rid of that negative influence about it being in a locked facility, because we really do take your safety as our number one priority.
Wonderful. Thanks. I've heard that from other clinicians before. They've said this feels like the safest work environment they've ever worked in, because they have that additional support of a sheriff's correctional deputy with you while you're providing care. So, what do you wish you knew?
She stole my answer. No, I would.
It's important. It's an important issue. It's something everyone's thinking about.
Yes, I mean, safety is a real. I've never felt unsafe. They're always there. They're there when you think they're not looking. They're there, right? You look to the right and they're right on the side of you if someone raises their voice. So, for me, I would probably say I wish I would have started sooner. Yeah, because this population is, where my heart is.
Oh, wonderful.
I think I would also like to add that this department operates, you know, it's, especially me in the administrative side, a lot of the positions and the roles that we're taking on are a little bit newer, so you are going to be learning, you're going to be supportive. And we operate like a family. I know the clinicians think of themselves as a family, and I feel very supported in my role, and I love the people that I get to work with, and knowing that I'm providing services to the underserviced, it really just is a complete package.
Yeah, it's true. You're never alone. Like, somebody's always there, right? So.
I think I heard Antionette refer to your team as a family before, so I hear that word all the time in talking to these folks. So next, I wanted to go to your questions. So does anyone have any questions for our panel? And I'll bring you the mic. Great, here you go, sir.
Good afternoon. So I was just kind of curious, what are the current trends, or what are you currently seeing now? It sounds like both of you have a lot of experience in this field. So what are you guys kind of seeing now with the jail population?
No, I don't have data, so don't quote me on it. I just know that working with my clinicians and just hearing, like one of the trends that I'm seeing is that the age of the people that are coming into custody have changed drastically. Like we're seeing a lot of younger kids come in, and then on the other end of the spectrum, older clients, and trying to like switch it out to see how are we going to service this majority of the older clients, how to service them, right? Because we've never had we have high numbers of older clients recently. So that's one of the trends that I've seen recently.
In terms of any hiring trends, that was a question I was going to ask Alyssa. What's on the radar for your department right now? What do you anticipate you'll be hiring for soon?
Yeah, I think our biggest focus right now is direct patient care. Like I stated before, we have a really big push to hire medical assistants. So for the medical assistant to qualify, you either need a certification or 1 year clerical within medical setting. The majority of our medical assistants do blood draws, so if having a phlebotomy certificate, whether you have one or you're interested, our department is open to supporting you to get that certification. So allotting time for you to do the training as well as paying for the certification in itself is something that we're willing to do because that's our biggest need. We will have some LVNs hopefully with the new budget. I think, as we all know, a budget is an issue for Santa Clara County as a whole, really everywhere as a whole. But that doesn't stop our mission in providing the direct patient care. So we still are striving to ensure that we have enough staff to make sure that the patients are receiving the care that they deserve. So right now it's medical assistants and LVNs.
Awesome, thanks. Any other questions? Here you go. Any missteps?
Hi, good afternoon. You mentioned there's like a lengthy hiring process and you're willing to provide time allotted for training for positions that you guys need. Are you specifically looking just for people coming from the medical field, or are there any entry positions that you guys hire for?
So with custody health, there's a range of positions. That's just our biggest focus right now. The way that the county does their hiring is based on title and not necessarily department. So if ever you see a position on secjobs.org, it's going to be for any department within the county that has that vacancy, unless in the title it specifically calls out a department, then you'll know it's department specific. So for our medical assistants, it is department specific because we're hiring for such a big number. Right now, it is extra help because we are waiting for our positions with the new fiscal year in July. So our plan is to hire as extra help and then turn these positions into coded positions. So when I mentioned the lengthy process, just the public hiring process is a little bit longer because there's merit system rules. So a job bulletin needs to be posted for 2 weeks. There's an appeal period, there's review periods. So the time that the department submits the request to fill the vacancy to the time that the department receives a list of names to interview could take, a month or two. And that's more what I'm speaking to. However, also with custody health, because you're in a locked facility, we also have a security clearance. So we do fingerprinting and a DOJ background, which can take roughly 4 to 8 weeks, depending on just volume of requests. And however, with that, working within the facilities, there is a pay differential, so there is a benefit to it. So that's why we really want to get a head start on the medical assistants, so then we can then turn them into coded positions. But those are just the biggest ones. Like I've said, we have clerical that support our medical providers, and we have management roles, but our biggest positions that we are hiring for is for our direct patient care.
Awesome, thanks.
Oh, hi. I just want to appreciate your compassion for your work. So Very much appreciated. So my question is, how long is the certification process for the medical assistance learning? Because for myself, I'm coming from a behavioral background, and I am actually very interested in on patient person-to-person interaction.
Yeah, so for each position, it's going to be based on the employment standards. So when you see a job opening and you click on it, where it says employment standards is going to be how you qualify. For the medical assistant specifically, there's two different ways that you could qualify for this position. So either by the certification, which you can get through a trade school or a community college. We are working with San Jose City College to kind of build a relationship for the students. That's just one of the first ones. We are planning to connect with more schools in the area so we can build that pipeline and establish those relationships. So for a program like that, I believe is 9 months. They could have hybrid programs for like trade schools, so it depends on where you go. Without the certification, you can qualify through work experience. So you can do 1 year of clerical within a medical setting, and that will also qualify you.
Hi, I was wondering, do you have any IT positions available here as well? Because I'm basically in the IT area. I'm looking into IT sector, if you have any openings.
Not specifically in our department. However, TSS does have positions that's dedicated to supporting different departments. So within TSS, they'll have positions that support IT functions for our department.
Okay.
Yeah, and TSS stands for Technology Services and Solutions. They have a booth outside, so if you want to go talk with them. But yeah, they're the centralized tech hiring firm that positions people in individual departments. And we do have a lot of tech positions in the healthcare system, but they do live within that technology department. Any other questions?
I'm a little curious about in terms of like the day-to-day care with the patient. You mentioned like the anecdotes that stand out, or like, okay, when the patient makes you laugh or like brightens your day. Like, do you have any anecdotes to communicate about those experiences? Like you mentioned that like some of the most memorable experiences in the when you're caring for the clients, sometimes they make you laugh or you make them laugh or something like that. Like, do you have any anecdotes you want to share about daily
Memorable interactions, or maybe situations where you feel like you really made an impact on their life?
Yeah. I mean, we're always, now I see patients infrequently because I'm a PM3. So, but if a patient requests to see me, I do go out to see them. But I had a visit recently with the client because he requested for me to come see him. And basically, he was asking for more services. And so in order to get them, he was like, well, I got to talk to your manager. So I went out. And he was hilarious because we were waiting for him to come in, and he came in and he looked like he was like all tired and sleepy. And then when I was like, oh, so hi, I'm Antionette, you asked for me to come. And he was like, what? Like, he woke up and I just started laughing. So I was like, oh, so you're joking with me? But it was a good interaction. Like, I've never heard my name called so many times. Every sentence was Antionette this, Antionette that. And I just had to, afterwards I was talking to the other person that went with me, and we were just kind of cracking up. And then I'm walking across campus, actually Monday, and I hear Antionette, and I'm just like, what? It's him. And he's like, Antionette, I just want to thank you. And I'm like, okay, yeah. So, or I had a client when I did carry cases. He came in, he was not on his medication. He had just came in, but he was receptive to taking his medication, so he started taking his medication. And so I saw him, I was seeing him weekly, and then like after about 3 weeks, like his whole demeanor, his ADLs, which is he took a shower, brushed his teeth, combed his hair, and all that stuff that he wasn't doing when he first came in, like all of that changed. And so stuff like that, like to know like you make a difference, and the patients that we see live is a big thing for me, which is why PM3s typically don't see clients, but I make it my business to see them, not only because I want to see them and it gives me joy, but also I want to know what my clinicians are going through, so if they come and tell me something, I'm aware.
What I would say is maybe the beginning to the end. You know, as we've stated before, sometimes our patients come in and they've never seen a medical or mental health provider, and we at Custody Health are working towards establishing a lot of different policies and procedures to make sure that when you come in and the patient gets assessed, that we are making these referrals and that we're establishing the care in a timely manner based on national standards. And we are really, our focus right now is also follow-up in patient care. So seeing how somebody comes in and there's trauma, there's substance abuse, there's mental health issues, and really getting them to stabilize. And now, you know, they have their diagnosis, they have their medication, they've seen the eye doctor, they've gone to the dentist, they are taking their diabetic medication now. So just seeing the progress in their overall well-being is, I think, very satisfying. And when they leave, connecting them with community resources, because it doesn't just stop there. Like, our job is not done there. We want to make sure that when they leave the facility, that they're provided with the resources and the support that's going to help them so that, you know, they don't come back.
That's a great point. Another department I will flag, the county has a reentry services department that works very closely with custody to help orient and adjust and serve people when they're readjusting to life outside of custody. So this county is a really rewarding and connected place to help make sure that people, after they're getting out of custody, have everything they need to survive and thrive outside of jail. Oh, I think.
Go ahead. Oh. Okay. Hi, I'm currently a CEO with the state, and I just recently got my license as an RN. Do you guys do lateral transfer?
From a correctional facility to a registered? So we do, well, I know for the deputies, they do lateral transfers. However, since it's a state department to a county, it would have to be an application through the open competitive process. And it would just depend on what our openings are. I know for custody health service, there's not a vacancy for a clinical nurse, but there could be opportunities in other departments for clinical nurses. So it's there, but it won't be considered a lateral. However, if you're speaking to benefits and things like that, if it's CalPERS and all of that, it should translate, but we have a benefits department that will be able to answer those questions for you.
And one thing I will flag, like I think we discussed earlier, if you wanted to come in as a correctional deputy, we would love to I would love to talk to you about that position. You could come in, and then when there is a nursing position open up, that could be something that you could transfer to easily. But yeah, let's talk afterwards if you're open to that.
Thank you so much for your time and for your explanation. And thank you for your explaining about the abbreviations. They are really useful, because I want from those, please, when you talk about the abbreviations, please open it, because in different situations they have different meanings, and it's not familiar with many people, same as me. Thank you so much.
You're 100% correct on that, because there are so many abbreviations in the county, so thank you so much.
We should publish a guide to it. We speak a different language sometimes, so I'm grateful you're here so that we can translate. Does anyone have any other questions? If not, I wanted to introduce our last speaker to wrap us up, my boss, David Hebner. He'd like to say a few words. Thank you for being here.
Yeah. Thanks, Cassie, and thanks to the panel. That was incredibly insightful, and I think says not only a story about custody health, but about this county, about the incredibly impactful work that you can do at this county. I'm always in admiration of what's happening at Custody Health and really wanting to set the gold standard for what can happen in this really sensitive space. And so appreciative for all the work that you all do and that you're doing, leading this work across the county. And then I just wanted to extend a huge thank you to all of you for joining. I hope today's session was informative. I hope you were able to get out and talk to some of the other folks outside as well. The weather's also gotten much warmer over the last hour and a half, so encourage you to go back out there, but just really appreciative that you all took the time to be with us today to learn about the county, and if there's more information that we can provide, don't hesitate to let us know. What I always find most meaningful about working here is the impact that we can have on this community, and I've been here now almost 2 years, and that only is proven every day by learning about the incredible work that is playing out across our dozens of departments, and really appreciative for all the work that you all do and that my colleagues do, and I get to have the lucky spot to tell that story and to try to attract other folks like all of you to come join us, and we hope you will, and encourage you to apply and let us know if you have other questions. Thanks again.
Thank you. So with that, we'll close up this session. I know our speakers are going to be able to go back to the table at Custody Health if you have any additional questions for them. I'll be heading over there or to the ESA table, which is where you can talk to anyone from our human resources staff. So please go out and talk to the tables. Make sure you've taken a picture or scan that QR code so that you can save the link to our Custody Health department. I would love everyone to sign up for our email list to make sure that you get all of our job interest notifications by email by the time you leave today. So talk to me or someone else wearing a county blue t-shirt and any of those HR analysts can help sign you up to get you on our email list. So you find out about all these jobs we talked about today as soon as they open up. So thank you for joining us.